Good afternoon and welcome to the 2025 Educational Recognition Awards and last lecture. It's wonderful the opportunity to be all together for this terrific annual tradition, one that recognizes and respects the heartbeat of our academic institution, our outstanding mission-driven faculty educators who, with passion, purpose, and precision, prepare our learners to realize their educational aspirations and thrive in their future professions. Our faculty, whether based in Worcester, Springfield, Burlington, or other locations, are exceptional stewards of our students' education, and our colleagues, who will be appropriately recognized today, epitomize the symbiotic roles of teacher, mentor, and role model. To each of our awardees, please accept my congratulations on your well-deserved recognition, and thank you for contributing in the many ways you do to make UMass Chan such a rich and rewarding academic environment. Later in today's program, and before transitioning to the last lecture, I'll have the privilege to present the 2025 Chancellor's Award for Excellence in Mentoring to a faculty colleague who has mastered that art of mentoring. Following that presentation, we'll immediately transition to the last lecture, when we'll have the opportunity to learn from a most esteemed educator, Dr. Mary Callery O'Brien, who will deliver this year's last lecture, entitled Helping to Shape the Future of Healthcare, the Multifaceted Roles of the Teacher in Advancing Medical Education. I'm sure it will be a treat when we get to that point in the program. To kick off the presentation of this year's Educational Recognition Awards, it's my pleasure to invite Dean Joan Vitello of the Tan Ching Fan Graduate School of Nursing to the podium. Dean Vitello.
Good afternoon, everyone. So I have the privilege of giving the first award, which happens to be the Dean's Award. And I'm giving this for outstanding faculty contribution to our graduate nursing education. And I'm going to ask Dr. Terry Aronowitz to come up so I can share, and congratulations, first of all. Terry also had a little mishap with her wrist, so she's in a little cast right now. I am honored to nominate Dr. Terry Aronowitz for the Dean's Award for her outstanding contributions to University of Massachusetts. Having served with distinction for 15 years in the nursing department, Dr. Aronowitz has exemplified excellence in teaching, research, and service, leaving an incredible impact on our academic community. She has been a faculty member within the UMass system since 2010. She was faculty and tenured at UMass Boston in 2017 and then transferred here to our school in August of 2020. She was inducted into the American Academy of Nursing in 2017. She's been an exceptional educator, mentoring generations of faculty and students, shaping the intellectual growth of countless scholars. Her innovative teaching methods and dedication to student success have set a high standard for academic excellence. Additionally, their research contributions in nursing have significantly advanced knowledge in our discipline, earning her recognition at both national and international levels. Beyond her academic achievements, Terry has provided unwavering service to the university, taking on leadership roles such as becoming our Associate Dean of Research and Innovation. Her commitment to fostering collaboration and advancing institutional goals has made a lasting impact on our community. She has received grants and publications. In conclusion, Dr. Aronowitz is planning to retire after her incredible year and will be greatly missed starting this July. Please join me in congratulating Terry Aronowitz for receiving So our next award is for the Clinical Education Award for outstanding contributions to student clinical education. One's from the DMP, and then I'll list the other one from the graduate entry pathway. So would Tyler Warren please come? Tyler, congratulations. So let me quickly tell you a little bit about Tyler. He's an acute care nurse practitioner here in the Department of Critical Care at UMass Memorial Medical Center. He has been a preceptor at the Graduate School of Nursing for many years. His ability to share his immense knowledge with us students in the clinical setting is unmatched. Not only does he precept students, but he also runs a critical care elective for our NP students. We are grateful to have Tyler as a preceptor and part of the Tan Ching Fen. Thank you for your dedication and support to our learners. Thank you. The next one is from our graduate entry pathway. Would Rebecca Hammond please come? I just met you, Rebecca. Becky. We are pleased to award Becky Hammond the Clinical Education Award. She's an essential member of the GEP team in both lab and clinical. She works with students from the moment they start GEP prep until they complete their summer practicums. Becky has taken on increased responsibility in the lab, constantly working to improve our students' experience through planning, open lab, teaching skills, and organizing supplies, which is huge. She has invested in her students' success, frequently communicating pertinent updates to the full-time team and planning for student success. Becky holds her students to high standards while also evidencing a caring and supporting demeanor with them. She also showed her commitment to continued development as a clinical instructor by completing the Clinical Academic Faculty Education Program. That's a mouthful. We are very grateful for Becky for her dedication to our GEP learners and congratulate her on this well-deserved award. The next one is our Student Education Award, and I'm going to ask Dr. Mary Antonelli to please come up. I know I saw you right there. Mary, congratulations. We are very proud to award Dr. Mary Antonelli the Student Education Award for outstanding student education. She is a dedicated and inspiring member of our nursing faculty who has made outstanding contributions to nursing education. This award recognizes her unwavering commitment to student success, academic excellence, and the advancement of nursing practice and healthcare quality. Throughout her tenure here, she has consistently gone above and beyond in mentoring, teaching, and guiding future nurses who are in our master's program in nursing and interprofessional leadership. She's also known for her deep knowledge of the quality improvement field from spending many years on the clinical side of her career. Whether in the classroom through interdisciplinary education contributions or through her interprofessional trainee quality council leadership in the clinical setting, she has continuously demonstrated a passion for nurturing the next generation of nursing professionals. Students often speak of Dr. Antonelli's ability to make complex concepts accessible and to foster an environment where curiosity, empathy, ethical decision-making, and critical thinking thrive. Colleagues praise her innovative teaching methods, her collaborative spirit, and her leadership in curriculum and program development. This award is a testament to the impact of Dr. Antonelli, not just within the walls of our school, but across the wider UMass Memorial Health System. Please join me in congratulating Dr. Antonelli on this well-deserved honor. We have some new awards. This is called a Patient Educator Award, and it acknowledges the importance of patients and their caregivers as classroom teachers in enriching the experience of our students and making them better providers. I just want to make sure, is Robert Dyer here? No. Okay. Then I won't. I want to congratulate him, but I'll do that when he's feeling a lot better. The second one is Ace Young, and so I'm going to ask Ace to come up here. She is the daughter of one of our graduating NP students on June 2nd. So Ace, congratulations. So let me tell you a little bit about Ace and why she was nominated for this award as patient educator. Evidence reveals that healthcare professionals, including nurses, don't always get things right when interacting with and caring for people different from themselves. When things go wrong, it can lead to feelings of neglect and disrespect and diminished dignity and trust for those to whom we serve. At UMass Tan Ching Feng Graduate School of Nursing, we are committed to educating nurses and healthcare professionals of the future to be responsive to the unique needs of others. This year, the faculty and learners from the Advanced Health Assessment course, Nursing number 615, engaged in a simulation experience to improve interview skills and clinical reasoning with people who identify as transgender, non-binary, and gender diverse. You, Ace Young, a busy rising sophomore at Mount Holyoke College, volunteered your time and lived experience to help educate 56 advanced practice nursing learners on the compassion and sensitivity essential for caring for those who identify as transgender, non-binary, and gender diverse. Your actions carried out in the role of standardized patient helped our learners appreciate cultural humility as a foundation for building mutual trust and respect. We are grateful, truly grateful to you for helping us as we continue to improve the clinical education and competencies of nurses necessary for establishing interactions and environments where people can feel safe, respected, and their health care is improved. It is our privilege to honor you with the Patient as Educator Award, Ace. So it's now my privilege to introduce Dr. Mary Ellen Lane, who's the Dean of the Graduate School of Biomedical Science. Come on up, Mary Ellen.
Thank you, Dean Vitello. This event really marks the start of my favorite time of year, a time when we are immersed in the accomplishment, excellence, and achievement of members of our community. And reading the nominations for our outstanding educators, both faculty and postdoctoral scholars, and eventually the students, I really appreciate the privilege of leadership, of being the leader of the Morningside Graduate School. Especially in years like this, when everything seems a lot harder than usual. And so before I say 150 nice words about each of our 6 faculty that we're recognizing, I want to take some time to say just a few words to all of the faculty of the Morningside Graduate School. There's a line from the 1968 poem, The Paradoxical Commandments, that's been going through my head for the past several months. What you spend years building, someone could destroy overnight. Build anyway. So this year, our 6 admissions committees faced record applicant numbers and responded with record-setting engagement and efficiency. And this didn't happen by accident. This was the result of years of intention and care by incredibly skilled staff and deeply committed faculty. And as we all know, those efforts did not come to fruition in the way that we had hoped. And the future of our educational mission remains uncertain. Reimagining graduate education and figuring out how we move forward is the work that's ahead of us. And I know that you also carry the weight of sustaining the research mission, and I see the strain and the real uncertainty, but through it all, you've continued to mentor, to teach, and to serve, and to build the future that we hope to have. I want you to know how much your partnership in our educational mission means to me, especially now. Your efforts matter, your presence matters, and you matter. And I'm honored to call you my colleagues. So if you've ever so much as delivered a single lecture or led a discussion group or served on a track or a qualifying exam committee, mentored a rotation student, or answered an email from a student, or helped a trainee think through a challenge, and of course, those of you who do much, much more than that, thank you. And let's take just a moment, because I'm on a schedule here, to acknowledge that in the hardest circumstances, you keep showing up and you build anyway. So thank you. The first award is the Dean's Award for Outstanding Contributions to Graduate Education, and this award goes to Dr. David Grunwald from the RNA Therapeutics Institute. I am recognizing with this award David's outstanding leadership in shaping a curriculum and educational strategy. As chair of the curriculum committee, David has gone far beyond expectations, including leading curriculum retreats and attending department meetings, which have created space for collaborative idea generation. The work has fostered genuine faculty engagement and a strong sense of shared ownership of the curricular direction of our programs. David's efforts have generated real excitement about the next phases of this project, and he, along with his colleague, Angela Mesmer-Blust, have had an instrumental role in the development of the RNA Therapeutics and Biology Training Program, which is a thoughtful, ambitious initiative that promises to serve as a model for an integrated, competency-based graduate training program. David's active contributions to the ITC Education Subcommittee have also meaningfully shaped broader institutional efforts. And finally, David's generous collegiality, reflected in countless thoughtful conversations with me and many others about curriculum and the future of graduate education, has been a source of insight and inspiration to many. Thank you, David. Faculty Award for Outstanding Research Mentoring and Commitment to Student Professional Development goes to Ann Rothstein. From the Department of Medicine. Ann was nominated by students that she's mentored directly in thesis research and students for whom she served as a member and chair of their Thesis Research Advisory Committee. Ann's an extraordinary mentor whose deep compassion, rigorous standards, and unwavering dedication have shaped the lives and careers of countless trainees, including a Nobel laureate. She champions every student, not only in their scientific growth, but also in moments of personal hardship, offering support that is both fierce and kind. She's a meticulous scientist and tireless advocate who nurtures excellence with a mix of humor, high expectations, and a relentless belief in her mentees. From midnight manuscript edits to organizing community building seminars, Ann's efforts stretch far beyond what is expected. Her impact resonates through her students, postdocs, and junior faculty. Ann leads by example in the classroom, and in the lab, and on advisory committees. She is, without question, a transformative force in the scientific training and deeply deserving of this recognition. Thank you. Now I'd like to recognize 2 postdoctoral scholars for outstanding contributions to trainee mentoring and professional advancement. And whenever I give this award, I want to point out to the community that education is not in any way a formal or official part of postdoctoral scholars' responsibilities. Those who are recognized by this award are among those of our postdoctoral population who have just taken it upon themselves to mentor the students around them, very often in the labs in which they work and sometimes in the wider department. So what are two awardees, Io Long Chen, who goes by Wells, and Flavienne Silva, who goes by Flavi. Please come forward. So Wells is an exceptional mentor, recognized for his patience, clarity, and integrity. The frequency with which students nominate these postdoctoral mentors use the word patience, I think, is really telling. It's not a quality that a lot of people have, and so thank you for that. He constantly guides trainees in the Watts Lab and beyond in thoughtful explanations, empowering them to develop independent critical thinking skills. His mentorship goes beyond technical guidance. He supports students through scientific challenges, ethical dilemmas, and professional development. He models humility and respect, whether troubleshooting experiments or fostering a culture of accountability. He's deeply invested in each student's growth and always makes time to support others regardless of his own workload. His presence strengthens the lab environment and inspires confidence in those around him. His impact is evident in the skills, confidence, and sense of purpose that his mentees carry forward. Flavia is an exceptional postdoctoral fellow whose mentoring has deeply enriched the training environment in the Girton Lab and beyond. She combines scientific rigor with remarkable generosity, always ready to help with experiments, review proposals, and provide thoughtful career guidance. Trainees consistently describe her as patient, clear, and insightful, with a unique ability to explain complex concepts and empower others to grow. She supports students at every level, from launching independent projects to navigating graduation and job searches. Beyond the bench, she fosters a culture of collaboration, encouragement, and inclusivity that permeates the entire lab. Her own excellence and achievement, seen in the prestigious fellowship and high-impact publications, serve to inspire students. Despite her many contributions to others, because of her influence, students are better scientists and more confident researchers. Thank you both. For outstanding contributions in the lecture and classroom setting, I'd like to recognize Dr. Robert Brewster from the Department of Systems Biology. Rob was nominated by students in the Systems and Computational Biology course, which is a course that he was recognized for developing almost a decade ago. According to the students, Rob brings preparation, enthusiasm, and clarity to the classroom, setting a high standard for excellence in teaching. Students consistently note his energy and deep engagement with the material, and he takes evident pride in helping learners grasp complex and abstract concepts. His lectures are both intellectually rigorous and welcoming, creating space for curiosity, connection, and deeper understanding. Rob stands out to the students for the consistent care and seriousness with which he approaches his educational responsibilities. And beyond the classroom, Rob's also been extending his impact through developing and leading a summer undergraduate research program that successfully welcomed students into the field of systems biology. Rob's joy in bringing students at all levels meaningfully into scientific conversation makes him a uniquely dedicated and effective educator. And our final award is Outstanding Contributions to Educational Service. And this goes to Dr. Paul Greer from the program in molecular medicine. So Paul was actually nominated for a couple of awards, which is a testament to the breadth of his contributions and impact. But it's his extraordinary commitment to the broader graduate educational enterprise that is really what we had in mind when we developed the Educational Service Award. He serves on a very large number of tracks. I think it's somewhere in the area of 30, which should be illegal, but... and QE committees, but I think what that means is that students clearly recognize him as somebody that brings kind of rigor and compassion to the sometimes scary experience of the track and the qualifying exam. He serves on, right now, the admissions committee and the curriculum committee and a few subcommittees of those committees. And he does this out of genuine dedication to students in the graduate programs that they navigate. He's steadfast, reliable presence who brings thoughtfulness, generosity, and good judgment to all of his service. Within his department and beyond, he's earned a reputation as someone who shows up, contributes meaningfully, and helps create positive and inclusive environment for all trainees. His mentoring is deeply appreciated by many, including those outside his lab, but it's his consistent, service-oriented leadership and his genuine commitment to supporting education at every level that truly sets Paul apart. This award recognizes the breadth and depth of his impact and the generous spirit in which he offers it. All right, thank you all for your many contributions. And now I would like to call Dr. Manas Das up to the lectern to introduce the Educational Policy Committee co-chairs.
Thank you, Dean Lane. I'm Manas Das. I'm the Associate Dean of Undergrad Medical Education in T.H. Chan School of Medicine. And I would like to take this opportunity to express my deepest gratitude and appreciation for all faculty members that work relentlessly in the School of Medicine to shape the lives and future of the aspiring physicians. It is my greatest privilege to introduce and invite two remarkable colleagues, two remarkable physician leaders and faculty leaders to the podium. They are the co-chairs of the Educational Policy Committee, Drs. Leila Gianaris and Dr. Erin McMaster, who will present the awards for the School of Medicine. Our student favorite, Dr. G, is an associate professor in the Department of Radiology and leads the gross anatomy curriculum in Vista. And over the past 3 years that she has been a co-chair of EPC, she has brought clarity, thoughtful insights, thoughtful leadership, and a lot of student-centered processes to the EPC, the processes of EPC. Dr. Erin McMaster is an associate professor in the Department of Pediatrics. She has been serving as the EPC co-chair for the previous 6 years until very recently we, as in the Office of Undergrad Medical Education, stole her from that role. And she has a new role as an assistant dean for the clerkship curriculum. And again, she is shining there as well for her vision for student support and her passion for clinical education. So without further ado, I will turn this over to Erin and Leila. Thank you.
Thank you, Dr. Das, for that wonderful introduction. We are pleased to be here to present many of the Educational Achievement Awards. We will start off with the Educational Achievement Star Awards for faculty. These awards are given in recognition of excellence for outstanding individual or team achievements in undergraduate medical education, typically for a specific curricular enhancement or innovation. This year, we will be honoring 2 individuals and 1 team. If I can have Dr. Ryan Tai please come forward. Dr. Tai is the Radiology Clerkship Director and was instrumental in the development of the new Radiology Clerkship, which has been received enthusiastically by the students. Dr. Tai led the Radiology Clerkship Build team, which designed and implemented the curriculum. He ensured that the curriculum was focused on giving students a hands-on interactive experience in imaging, interpretation, and utilization. All of these efforts ensured that the students left the clerkship with the fundamental imaging skills that can be built upon throughout their medical careers. Moreover, Dr. Tai continues to assess and improve upon the clerkship to make it an even better and more meaningful experience for students each month. Please join me in congratulating Dr. Tai. Next, I'd like to have Dr. Wissam Deeb come forward. Dr. Deeb is the Neurology Clerkship Director and is being recognized with a STAR Award for developing and implementing several neurology clerkship innovations. These include a student-led morning report to engender more autonomy and develop skills of leadership, oral presentation, case discussion, and a deeper understanding of neurological disorders. Social work observerships to immerse students in the intricate world of health system science and societal factors in healthcare. A game-based game feud similar to the Family Feud, where the students compete through a series of high-yield neurology outpatient topics. He's also incorporated a training electronic health record into the simulations to add more realism to the cases and help train students to use these systems more efficiently. And last but not least, he has implemented a student mentorship program, which has been very highly rated by the students. Please join me in congratulating Dr. Deeb. Next, we'd like to recognize a team, Dr. Linda Long Bellil and Dr. Heather Finlay Montreal. Doctors Long, Bellil, and Finlay Montreal are being recognized for their commendable efforts to infuse disability-related content into the undergraduate curriculum. They lead an interdisciplinary working group of students, faculty, and community members who have developed comprehensive learning objectives that guide content now embedded across the curriculum. This includes new content in preclinical and clinical years and the participation of people with disabilities in simulated interviews for students to learn, refine, and demonstrate disability-related competencies. Examples of some of the topics they include are patient-centered care, effective communication, disability etiquette, advocacy, appropriate evaluation and treatment planning, and more. These efforts are ongoing and ensure that UMass Chan is training tomorrow's physicians to meet the needs of those with disabilities. Please join me in congratulating this outstanding team.
Our next award is for our awards, I should say, are for the Resident and Fellow Award for Excellence in Medical Student Education. And these awards recognize a resident or fellow who is especially motivated and inspired to teach students, to mentor students, and to improve the educational content of student rotations and clerkships. And we have one from the university campus and one from our Bay State campus. So first I'd like to recognize Dr. Tenes Paul. Dr. Dr. Paul is a cardiology electrophysiology fellow who is receiving this award. He has voluntarily mentored medical students, predominantly second-year medical students, in clinic and in the electrophysiology lab. Having second-year medical students with limited knowledge of cardiology is a daunting challenge, but he takes the time to teach the students about EKGs and arrhythmias. His dedication towards sharing his knowledge with others is both reaffirming and inspirational, and his patience is matched by none. Congratulations, Dr. Paul. And Dr. Chidibum Ezena. Dr. Ezena is a second-year internal medicine resident receiving the award from our Bay State campus. For the first time this year, the Perch third-year students have given overwhelmingly positive feedback about the effectiveness of their EKG curriculum in the internal medicine clerkship, specifically highlighting the exemplary EKG teaching of Dr. Ezena. He has a passion for cardiology and has a gifted ability to break down this complicated topic in a manner that students can easily understand. He teaches many of these weekly sessions during each integrated unit, leading very engaging sessions for the students who really value all of his time. So thank you so much. Congratulations.
Our next award is the Student Star Award, and this is given in recognition of excellence for outstanding voluntary, scholarly, and vocational achievements in medical and health education by medical students. Would Jenny LaPalma please come forward? Jenny has been an advocate for inclusion and LGBTQ curriculum and rights at UMass Chan throughout her enrollment. Over this time, she has created an evidence-based series of learning modules teaching inclusive and appropriate LGBTQ+ care. She continued this work in a fourth-year drive elective and is presenting to the UMass Memorial Primary Care Network as part of a CME session in April, or did present, I should say, in April. She is an outstanding candidate for this award and a true star. Please join me in congratulating Jenny on this award.
Next, we have the Retired Faculty Teaching Award for Excellence in Undergraduate Medical Education. And I just want to recognize Scott Wellman, who could not be here today, for his valuable contributions to the pediatrics clerkship. And now the Administrative Specialized Staff Award, which recognizes the essential contributions of administrative and/or specialized staff to the success of our educational programs. Nominations can include examples of nominees can be involved in program planning and support, direct student engagement, educational or other roles that positively impact our learners and faculty. And this year's recipient is Michelle Carlin. Michelle has been supporting the clerkships for more than a decade in her role in IREA. She has a wealth of knowledge, and she is truly the go-to person for any clerkship question, which I can definitely vouch for. Michelle helps with the scheduling of all evaluations for every clerkship. She strategizes with clerkship teams. She runs reports whenever needed. She attends every clerkship curriculum meeting, and she provides crucial data to support the committee's efforts. She has helped the clerkship teams navigate multiple platforms that have been used for assessment and evaluation during the 3 different versions of the clinical curriculum in your time. And above all, Michelle is just a wonderful person who is kind and patient with everyone. She never gets frustrated with repeated requests for assistance. She's humble, and she always stays clear of the spotlight. And so it's nice to be able to recognize her for her tremendous contributions to our curriculum. Thank you, Michelle. And at this time, I would like to ask Dr. Stacy Potts, the Senior Associate Dean of Graduate Medical Education and Clinical Affairs, to come up.
Thank you. I am so happy to be here this afternoon to have the opportunity to present the first annual Deborah DeMarco Award for Excellence in Graduate Medical Education. In honor of the impact and outstanding leadership of our retired Senior Associate Dean of GME, the DeMarco Award recognizes GME leaders who have an established track record of excellence and by their performance leave an indelible imprint on UMass Chan and GME. Nominated by the GME committee and selected by the program leadership peers in the GME committee, many nominations were received, and our winner today is Dr. Elizabeth Beth Murphy, who I would like to invite down. We are honored today to also have Dr. DeMarco present with us. So when we get to the award presentation and the pictures, I'll ask her to come down as well. Dr. Murphy is the founding director of our internal medicine primary care track and also served as our associate program director for ambulatory training in internal medicine from 2015 to 2022. She joined UMass back in 1995 for her residency program in internal medicine, working closely with Dr. DeMarco in her chief resident year. And if I remember correctly, she also supervised and supported a very green intern during that chief resident year. The UMass community is fortunate that she was recruited to stay at that time and has continued to excel through her time here as a leader in graduate medical education. She's been celebrated with many awards as an outstanding educator, including induction into the Alpha Omega Alpha Honor Society, the Sarah Stone Excellence in Education Award, and multiple department awards. Her innovative, generous, collaborative, and humble approach to her leadership have led to many successes, and I'm so pleased to be able to honor Dr. Beth Murphy as the recipient of the first 2025 Deborah DeMarco Award for Excellence in Graduate Medical Education. And now, for a man who needs no introduction, Provost Flott.
Great, thank you. It is now my pleasure to present the Lamar Suter Award for Excellence in Medical Student Education to faculty who have made an indelible imprint on UMass Chan and American medical student education. This year's recipient is Dr. Heather Lynn Haley, Assistant Professor in the Department of Family Medicine and Community Health. And Dr. Haley will be retiring this year after 45 years here at UMass Chan in various roles. She's being recognized for her leadership of the Population and Community Health Clerkship for many years, which has been impactful to many generations of medical students. She more recently has become the leader of the Longitudinal Pathway in Structural Inequity, Advocacy, and Justice, and has also led and coordinated student activities in countless other community service learning opportunities. In the words of some of those students, Dr. Haley is clearly passionate about public health. She is flexible and kind and supportive of student interests. And again, the students want to say thank you for bringing together such diversity of perspectives and experiences. That's a quote. She truly has been a marvelous bridge between UMass Chan student community and our broader Worcester community. Congratulations. And now I'll introduce our Chancellor, Dr. Michael Collins.
Well, congratulations to all of our awardees. Clearly, the contributions you have made to our educational programs across our 3 schools are extraordinary, and it's wonderful to have the opportunity to recognize those contributions at today's ceremony. It's wonderful to welcome back Dr. DeMarco. I wish you didn't look so good and well-rested. You're going to give other people the idea that maybe they should retire. You know, Dr. Haley, come on. She always looked like that even when she was working. So, Deb, it's nice to see you. So to conclude the awards portion of the presentation today, I have the wonderful privilege to announce the recipient of the 2025 Chancellor's Award for Excellence in Mentoring. This award, which we established in 2016, celebrates mentoring as a foundational element of our academic community and the broader science, nursing, and medical professions. To be considered for this award, a faculty member must have been part of our community for at least 3 years, hold the rank of associate or full professor, and through their daily work exemplify the role and demonstrate the qualities associated with being an outstanding mentor. Now, I can tell you that this year's nomination process resulted in another slate of really, truly outstanding nominees. I want to thank the committee that was chaired by Dr. Celia Schiffer, a previous award recipient, along with many others who had the difficult job of evaluating so many terrific nomination packages and then provided me with a group of finalists, each of whom was deserving of the recognition, and therefore makes it even more difficult to make one selection. But with all of that as context, it's a privilege now to present the 2025 Chancellor's Award for Excellence in Mentoring to Dr. Mary Munson. So, Dr. Munson, you've been a faculty member here at UMass Chan since 2001 and currently serve as professor and vice chair for diversity and inclusion in the Department of Biochemistry and Molecular Biotechnology and serve as an associate vice provost for equity and science. You also are the current president of the American Society of Cell Biology, a high-profile position with a truly national audience. Now, these titles and many others I've not listed, while impressive, cannot come close to adequately capturing the full extent and impact of your contributions to scientific mentorship at our institution and more broadly across the nation's scientific establishment. Suffice it to say, in the world of mentoring, Dr. Munson, you're an undeniable rock star. The compelling collection of letters supporting your award poignantly and beautifully illuminate the central and foundational role mentorship plays in your professional identity. It's indeed a defining and distinguishing feature of your academic career as a bench scientist and has helped to shape how you approach the act of mentoring. As one colleague wrote, you bring your scientific hat to the mentoring endeavor, and you are interested in what works, what skills are needed, how to train mentors to acquire those skills, and how to create a community of mentors. Within our institution, your name has become synonymous with the role of mentor. Currently, you have 3 graduate students in your lab, and you have directly mentored and advised more than 70 scientists spanning the educational continuum from high school and undergraduate students through to postdoctoral researchers and research scientists. Recently, however, your contributions to the act of mentoring here on campus have expanded in size and scope as you've taken on even greater levels of leadership and responsibility. Indeed, your fingerprints are evident on virtually all mentorship initiatives, and in fact, you've spearheaded some of our signature programs that have contributed profoundly to the enriching collaboration and welcoming academic environment for which UMass Chan has become so well known. For your profoundly important contributions to shaping the practice of mentorship here at UMass Chan and beyond, and for empowering your mentees to realize their potential, I'm privileged to present to you the 2025 Chancellor's Award for Excellence in Mentoring. Congratulations. I'm now pleased to transition to this year's last lecture, a celebration of recognizing the art of teaching and those within our faculty ranks who have distinguished themselves as master teachers and esteemed educators. The 2025 last lecture will be presented by Dr. Mary Callery O'Brien, Associate Professor of Medicine, who is the recipient of both the 2024 Chancellor's Medal for Distinguished Teaching and the 2024 Manning Prize for Excellence in Teaching. By way of introducing Dr. Callery O'Brien, I'd like to ask you to turn your attention to the screen for just a moment. An educator who has been described as generous, unaffected, and honest, and who forges strong connections and fosters trust, who is known as a steadfast advocate for both students and faculty, whose influence extends far beyond the classroom, and who is known for igniting passion in undergraduate and graduate medical education learners. It's a privilege to present this year's Chancellor's Medal for Distinguished Teaching to Dr. Mary Callery O'Brien. For over 3 decades, you have educated and inspired medical students to become the best physicians that they can be. Your span of learners extends from the first year of medical school throughout graduate education and into the ranks of the faculty. You are known as a powerful role model in how learners and faculty can choose new roles that facilitate perennial growth and improvement. In fact, you are a shining example of excellence in patient care, professionalism, and compassion. It is indeed a privilege to present you with this year's Chancellor's Medal for Distinguished Teaching. Congratulations. So Dr. Callery O'Brien is joined by her husband, Dan, and 2 of their 4 children, Dan and Sean, I think. Yes, are they here? There you are. Hi, guys. How are you? Welcome. That was your grandchild who had that? Yeah, that's beautiful. Yeah, really well done. And sister-in-law, Sarah, and sister-in-law, Betsy. A warm welcome now, please, for Dr. Mary Callery O'Brien, who presents today's last lecture. Dr.
Good afternoon, everyone. And it's with the greatest honor and pride today that I stand here to deliver today's last lecture. Before I begin, though, I would like to extend my sincerest congratulations to all the award winners. You represent the elite in education here at UMass. Your passion and your dedication have truly set you apart, and as you'll see in a few minutes, you represent the heart and soul of my talk today. Are we good? So, when I set out to decide on what to speak about, I said to myself, I'm going to be in a room with those people that are my brilliant colleagues, my mentors, my role models, and my students. So many of you have shaped not only our field, but my own journey in medicine and medical education. How do you present something to the very people who set the bar for excellence so high and have taught and inspired you? I likened it to preaching to not only the choir, but the tabernacle choir. It was a little intimidating, and I likened it to being asked to cook for your favorite chefs. But after much reflection, I realized I didn't need to present anything profound. You already know a lot of that. But I needed to talk about something that excites passion and excitement in me. So now I have been involved in medical education for 3 decades, and if we had had sound, the chancellor, when he presented the award to me, said for nearly 3 decades, and I thought, oh my gosh, that's a long time. But then I realized that that was going to be the reason and why I was going to capitalize on that 30 years for my talk. I had the privilege in those 30 years of seeing the standards of medical education here continue to reach higher. And how did that happen? It happened because we as educators and faculty and leadership here welcome new discovery, embrace change, look to the needs of our learners, and we work together. And so I decided to focus on exactly that. How do you cultivate excellence in medical education? What has been that recipe? I look back on my 30 years, where at least I started and where we are now, and I compiled a list of the educational pillars that I have witnessed to be the cornerstones of forward progress. And then I looked at my experience as a teacher and an educator and my collaboration with so many of the tremendous educators here. And I realized that it is the teacher and the educator who is critical to delivering that curriculum. However, the teacher is not just a conveyor of knowledge anymore. We have many roles, and in order to really deliver that curriculum effectively, we have to take on many roles. Hence the title of my talk. So many of my students and residents over the years have asked me why I chose to come to UMass and why I have stayed. And the answer is, and has always been, that education is held in the highest esteem here at UMass Chan. Not just in a lofty mission statement, but I've witnessed it here in the trenches every day. I've seen throughout UMass Chan, from the very renowned scientists that I've had the privilege of working with in the Morningside School of Graduate Biomedical Sciences, to the educators I've collaborated with in the Tan Ching-Fen School of Nursing, to all of my UMass T.H. Chan colleagues. This institution values its educators, but holds us to lofty standards. And so, with any lecture, let's begin with objectives. So I broke it down into the what, the who, and finally the why. So the what. What defines and makes education excellent? Gone are the days that we just transmit facts on a whiteboard or we write the steps involved in a technical skill. Forwarding education requires leaders and teachers to embrace multiple educational pillars, as I've written here, not just the science. I'll outline a few of these pillars as I go along, and I'll probably give a few homegrown examples of how we are cultivating the excellence here at UMass. Okay, and next is the what, the who. The critical role of the teacher in fostering, furthering, and cultivating this culture of excellence. Every single one of these roles of the teacher is crucial to delivering a high-quality educational experience. Okay, and the reason we strive for excellence and work tirelessly in many of these roles is what I'm calling the why. Why do we need teachers at the cornerstone of delivering this excellence and this state-of-the-art education? The why is achieving education excellence to develop competent, compassionate caregivers is critical to investing in the future of healthcare for the safety and the well-being of the patients we serve. All right, so I wanted to begin today with a quote from Martin Luther King Jr. The function of education is to teach one to think intensively and to think critically. Intelligence plus character, that is the goal of true education. I felt this quote really aligned with our mission in medical education. Thinking intensively is more than just memorizing knowledge. It's clinical reasoning and problem solving. Critical thinking asks us to evaluate evidence, strive to avoid bias, and continue to embrace improvement. And yes, intelligence is important, but alone does not make it. Character, integrity, humility is what turns knowledge into healing. The true medical education does not just create the competent provider, it forms wise and ethical healers. All right, so now let's do a little bit more of a deeper dive. What is that recipe for excellence? What is the what? So where did I get this list? I compiled this list, and where did I get this list? Well, here's where the 30 years comes in again. This list came from what I have witnessed, and that which has moved us forward and made us better. And for the record, I am not the expert in this. Many of you are. So I did a deep dive in the literature as well, and I saw what was written about the upward evolution of medical education. And you know what I found? That we're doing this here. We are truly doing best practices. But I wasn't surprised. All right, so I will, in my talk now, I will talk a little bit about each of these areas and their role in creating the best medical education has to offer. So we'll start out with evidence-based learning models to enhance clinical and scientific competence, and we'll talk about simulation and engaged active learning. I'll speak about harnessing newer technology, and I can't talk about new technologies except to talk about AI and how we can use this to enhance many areas of education, research, and clinical care. I'll touch on the role of collaboration, both collaborative teaching and collaborative learning, and I call this the meeting of the minds, as a way and a means to deliver high-quality education. Probably one of the pillars that is most near and dear to me that I've been involved with. I will also talk about the role of lifelong learning. Education is only as state-of-the-art as its education and providers, so we need to give educators the opportunity to have this lifelong learning. And the last ingredient I will talk about, and one that is probably so critical to really delivering the robust medical education experience, and it reflects back on Martin Luther King's quote. Education must go beyond the books of medical knowledge and must embrace diversity, inclusion, humility, and much more. And this is the key here, to create an environment environment of opportunities for effective communication, collaboration, problem solving to improve healthcare and delivery for all patients. Our opportunity to deliver to develop our learners' sharp minds, but also strong moral compasses. All right, so now we're going to talk about simulation. And simulation is a modality that has evidence all throughout the literature in its ability to improve clinical skills, problem solving, and knowledge retention. From the escape room in my course, to enhance problem solving, to the use of virtual reality as a means of improving procedural skills, simulation offers excellence in consolidated learning. Our iCell Center is hugely popular here at UMass. It takes you over a year to get a reservation at the iCell Center. The expert leadership and staff with educators tailor creative simulation experiences to almost any type of curriculum. And let's talk about engaged learning now, the next part of my pillar in innovative technologies. Another key area that promotes deeper understanding is that of engaged and active learning, and that is the backbone of our curriculum in all three of our schools. And active learning can come in different flavors, and I'm going to offer a few here. The engaged lecture. So the engaged lecture is where we utilize platforms such as Top Hat on the left here, where we pose questions to have our learners problem solve. In the Graduate School of Biomedical Scientists, the Scientific Inquiry Program, where young scientists from varied specialties come together as a group to ask a question and to test a hypothesis. 2, the small group case-based learning sessions that incite discussion and critical thinking. This is a shout out to my MS1 group. If you're here, say ha. They were kind enough to come and support me. And these are the best practices of active learning. All right, and next is harnessing integrative technologies to promote active learning. And I can't talk about cutting-edge education without touching on the many uses of AI in scientific analysis, drug delivery, clinical care, and medical education. Dr. Melissa Fisher, who is one of our innovators here and our leaders at UMass Chan, and she's one of the innovators in our program in digital medicine, provided me with a number of exciting ways we are harnessing AI for education. With the use of generative AI to inform avatars that interact with learners and clinicians to learn and practice communication skills, to use of augmented reality to guide learners through procedures, and in this case, AI supporting faculty, which is how I primarily use it, for generating cases, helping to broaden the diversity and characteristics of cases, and also to help suggest in generating assessments. And you'll see that in a minute. But this is really only scraping the very tip of the AI iceberg and the importance it has and will have in healthcare delivery and medical education. So now let's move on to collaborative teaching, and one that I feel is not only a way to excite learners, but also to create a sense of camaraderie and a sense of shared goals among educators. I have been involved in so many programs and courses throughout my career that have involved collaborative teaching and education. from starting out in my career and starting the LPP program with Sarah Stone, to working with my fourth-year students teaching physical diagnosis to our first-year students, to facilitating small groups with various colleagues from other specialties to provide varied experiences to our learners, to probably one of the biggest highlights of my career, working with Bill Royer to direct the BWCT course in our LINK curriculum. This collaborative teaching not only provides innovative teaching experiences, but it also demands that our educators stay on the cutting edge of their fields, and it's incredibly rewarding. Working and teaching in BWCT with Bill and with other scientists, and now in the VISTA curriculum, I've had the opportunity to work with all these renowned scientists, and it's given us the ability to, in biochemistry sessions and physiology sessions, to illustrate the pathophysiology of disease from the bench to the bedside. We coined this term the clinical correlation in our course. But that's only my experience. There are many more going on here at UMass, from the anatomist collaborating with the radiologist to effectively illustrating the connection of anatomy with imaging. And again, there are so many more examples of collaborative teaching. And as you see here on the left, there are multiple benefits to both the educator and the learner for collaborative teaching. All right, we'll talk about lifelong learning now and CME. Good medical education never ends. There are a number of studies that have shown that CME is associated with increased and improved provider performance, as well as patient outcomes. We have to embrace lifelong learning so that our educators have opportunities to extend their learning. One example, and I'm going to shout out Dave Hayden here, is in our HEAL program. And HEAL stands for Health Education Academy for Leadership and Learning. And Dave is one of the co-leaders of this program, and I asked Dave to comment on what he felt the essence of what HEAL's mission was. And Dave said, working to create activities that bring together educators from all three schools to advance educational quality and innovation and to foster collaboration. It's a really excellent example of the opportunities for faculty for lifelong learning and collaboration. And my last ingredient, which honors the full spectrum of medicine beyond the scientific lens, is to integrate all facets of medicine, including humanism, ethics, and the human connection. As our Office of Diversity and Inclusion states, we need to shape the future of healthcare and medicine through embracing diversity, inclusion, and acceptance. And again, with the expert leadership in our DIO, along with our UMass Chan leadership, who continue to support this mission, we have so enriched our education. But we have so much more to do, and we must not go back. We must learn and teach cultural awareness and sensitivity. The awareness of our biases and knowledge of each other's views will help us create culturally competent behavioral strategies and practice. And all this is important so that we may all practice cultural humility, which is the ongoing process of self-reflection and being open to all views. This builds stronger and more respectful relationships with patients and with each other, and enables us to strive to deliver safe health care for all. One of the very integral programs that we have here at UMass that embodies the ongoing practice of cultural humility and acceptance of diversity and inclusion is the DRIVE program. This program, which spans all three schools, says the faculty, staff, and students at UMass Chan are deeply engaged and committed to working to strive for a bias-free curriculum. That is our goal. Another crucially important pillar, and there are many, and I'm not going to mention them all, is anti-racism. Structural and systemic racism accounts for so many health disparities in medicine, such as maternal mortality and chronic disease rates. Training and educating our learners to recognize and actively work against anti-racism is vitally necessary for equitable care. And because so much of our resources now are governed by state and federal regulations, we must educate our learners in health policy and public health. And one last example I'm going to offer is provider wellness. We all know there is so much burnout, depression, and emotional exhaustion in medicine, which leads to medical mistakes, lower patient satisfaction, and provider attrition, that we have to, and we do, embed wellness into our educational environment. By doing this, we promote resilience, we promote empathy, and ultimately better care. Together then, all these pillars support the development of providers who are not only clinically savvy, but also ethically grounded, socially responsible, and emotionally sustainable. All right, so now I'm going to recap. I presented a number of these critical key pillars of excellent medical education, and together these principles will hope to prepare our future providers to be effective, empathetic, and resilient in a complex, ever-changing landscape. So the next question is at really the heart of my presentation, is how do we deliver all these goods? How does all this get translated into working curriculum? And yes, the answer is the who. The crux of advancing medical education is the teacher or the educator. We as teachers are central to delivering this education. We work on crafting it, and we deliver it. But we are not just information providers any longer. We take on many roles, such as you see here, and each of these roles shapes the learning environment and ultimately the professional development of our learners. So let's talk about a few of these. As teacher as inspirer. First and foremost, we need to create that spark to ignite the learner's untapped potential. We do this through passion for our subject and dedication to the process. So passion for the subject, it's what I like to call loving what you teach. We need to incite that spark and that passion in our learners, but we need to make sure that we keep up with the expertise in our field, making sure that we are presenting cutting-edge material. We must also have dedication to the process, and this is what I call loving how you teach. And again, the teacher must engage in the innovative technologies I just spoke of. We must engage in CQI, continuous quality improvement, to promote further understanding and to hone our craft. And we must always try to improve the learning environment and curriculum delivery. And through inspiration, we create a positive learning environment, we create learner excitement, and we ultimately get learners to believe in themselves. So not only must we inspire, we must be a facilitator of learning, curriculum development, and assessment. And in this situation, we have to promote curiosity and critical thinking. We must guide problem solving. We must challenge the learner to work through the problem. And very important, we must create vigorous, varied, fair assessments that test both acquisition and application of knowledge. Next among the important role, and again, this is the role as mentor is a huge role, and I've broken it down actually into two different slides. So we have teacher as role model and mentor, and teacher has mentor and support system. The first one I'll talk about is the teacher as the mentor and role model. As teachers, we have the opportunity and the responsibility of being a mentor to our learners, to help guide, counsel, and facilitate their interests, and ultimately find their niche in medicine. In reality, we role model, well, everything. You see here, we role model critical thinking, patience, kindness, lifelong learning, cultural humility, work-life balance. As the mentor and role model, we facilitate the learner to create their own identity using best practices. And now the teacher as the mentor and support system. As a mentor, we show support and we care for our learners. We cheer them on in times of triumph, but we're also there to pick them up and help them navigate times of uncertainty. One example, and there are many here at UMass Chan, is our learning communities, our mentor programs, and our specialty advisor programs. This is a shining example of role modeling at its best, mentoring, providing support, and helping to find your niche in medicine. Not to mention creating meaningful interpersonal relationships. In these programs, the goal is to make sure that every single learner has someone to facilitate their interests and provide that support. We must be advocates for our learners. So moving along now, we have to circle back to the vitally important role as teacher as lifelong learner. That's an educational pillar, but we must, as teachers, must embrace lifelong learning. The teacher who is a lifelong learner keeps knowledge current and models an ever-learning mindset. When a teacher embraces learning, we model humility, curiosity, and adaptability. Teachers who embrace lifelong learning are always actively refining their teaching strategies. Lifelong learning is essential as it ensures teaching remains relevant, evidence-based, and responsive to the needs of the learner, the healthcare system, and society. And the teacher, again, must foster an environment of diversity, inclusion, representation, and cultural humility. Why? So that every learner feels valued and heard, so that we may foster a sense of collaboration and belonging, while celebrating and welcoming our individuality and differences. And ultimately, so we may continue to strive to provide education and patient care without bias. Okay, now we'll do a little example of some problem solving and consolidation. Those of you who know TOPAT will recognize this. So usually at the end of a lecture, before I summarize, I try to do some problem-solving and consolidative learning. And in this case, we use TOPAT as a platform. And what I did was I actually used ChatGPT to help me generate a question to consolidate what I've presented here. And on the left, you'll see my prompt. And I'll give you a second to read the question. All right, and so we would normally poll the students and we would see what they thought was the answer, and I hope you all chose answer B. All right, good. So again, this is just an example, and then we would actually, talk about it. We either discuss it or we provide some explanatory slides to consolidate the learning. So this is just an example of how we can implement these techniques to provide learners their ability to assess not only acquisition of knowledge, but their application of knowledge. All right, so now my summary slide. So in any good lecture, you should have a summary slide. And this slide acts as a conclusion that brings the lecture full circle, highlighting the takeaways from your lecture and bringing them back to the objectives and the goals that you outlined at the beginning is a way to ensure accuracy and to reinforce learning. It also gives the learner an example, a final ability or an opportunity to reflect on their learning and to see how this fits into the bigger picture. So why did I take the time to talk about these educational pillars and these critical roles? Well, in this day and age, when we are being asked to teach more curriculum in less time, see more patients in less time, publish papers in less time, I wanted to take a few minutes, or maybe 25 minutes, to recognize that we are doing this all here at UMass Chan, and we're doing it really well. We see the extraordinary nurses, scientists, and physicians that UMass sends forth every year, and that is phenomenal. UMass Chan is a force to be reckoned with. And I look forward to seeing us all continue this educational mission at UMass Chan to set that bar higher every year. All right, so before I conclude, I just want to say a few words of thanks. First of all, I'd like to express my deepest gratitude to all of you here. To Chancellor Collins, Dean Flott, Dean Vitello, Dean Lane, I thank you for your support. I thank you for this award and the tremendous opportunity you gave me to speak here today. And to all my colleagues, and there are many of you here, and I'm not going to name everyone for fear of missing out on somebody, but thank you for your wisdom, your unwavering support, and your collaboration. To my mentors, some here and some no longer with us, your guidance and counsel has shaped me in ways I will always carry forward. And to my students and residents, you are the heart of why I teach. Your passion, curiosity, and resilience inspires me every day. This lecture today is as much all of yours as it is mine. Thank you for being my motivation and for reminding me daily the purpose and privilege it is to be an educator and a physician. All right, and I could not finish my thanks without thanking the people who are most important to me in my life, my home team, my husband Dan, my 4 children, Dan, Sean, Molly, Patrick, my sister-in-law Betsy, who's here, my grandson Jack. They are my foundation and my greatest source of inspiration. Their love and support fuels my fire every day. They keep me grounded in purpose and remind me of what truly matters. And so to officially conclude now, I'd like to leave you with a quote. Pat Sargent, one of our writers here at UMass, did a story on this event last week, and he asked me what it meant to receive the Chancellor's Medal, and I said, receiving the Chancellor's Medal is the biggest honor of my career, rivaled only by the great honor and privilege I have to teach here at UMass and to care for patients every day. Thank you very much.
Really so well done. Thank you very much. It's to hear both the aspiration for what you hope for in teaching here and the inspiration you provide so that all of us can achieve that is really the mark of a great teacher. So thank you very much and welcome to all of your family. Thank you very much for being here this afternoon. It's terrific to have everybody here.